I don't get tired of that open. It's really great. Welcome to State of Affairs. I am Steve Adubato, coming to you from the Agnes Veris NJTV studio in beautiful downtown Newark, New Jersey. It is my pleasure to introduce two very special friends of the series. Betsy Ryan, who is president of New Jersey Hospital Association, and Larry Downs, CEO of the Medical Society of New Jersey. Thank you so much for joining us. Big picture, healthcare, hospitals. But before we talk ACA, what may or may not be going on in Washington, its impact on those of us in New Jersey, repeal, replace, who knows. But there is a new initiative that has just started. Read about it in some of the trades. It's called the New Jersey Healthcare Executive Leadership Academy. Two of you are part of it, your organizations. What is it? Why does it matter?
So the Medical Society and the Hospital Association have partnered with the Association of Health Plans to create a leadership academy to bring together the emerging leaders in each industry in a shared learning collaborative. I think the goal is to break down the barriers that exist between us naturally. We fight a lot in Trenton, and we wanted to bring together and have some shared learning, leadership, and work on a very important issue to the state of New Jersey.
And Larry, Seton Hall University is involved in this, correct?
Yes, Seton Hall is our academic partner. Again, we're trying to bring together three pretty disparate industries that are encased in the healthcare industry. So physicians who are providing care on the ground, facilities, hospitals, long-term care facilities, and then insurers who are paying for the care.
And so play this out for a second. So these healthcare executives come together, and I saw the list. And by the way, go online. People can go online and find out who these folks are. But they're healthcare executives from all different arenas, right? They go through this academy. They're trained by healthcare executives and professionals. They come out as better leaders. How does that impact the rest of us?
I think the most promise we have is to be able to build relationships where relationships don't currently exist. Our hope is...
What do you mean they don't exist?
Our hope is after the completion of this academy, folks will have relationships to the point where a doctor can pick up the phone and call a healthcare executives to work through a problem, have a better relationship with their hospital executives. The problems that we're focusing on, and this first academy focuses on improving end-of-life care, these are significant problems that cannot be solved by physicians alone, hospitals alone, or health plans alone. So we need to have a collaborative relationship in order to solve these pressing healthcare problems.
Betsy, long overdue.
Absolutely. I think we tend to operate in our silos, and this is breaking down those silos and creating the relationships to tackle important issues, including end of life, and we hope into the future.
By the way, talk about end of life for a second. Some of the research that we've seen shows that New Jersey spends, I believe, more than any other state in the nation in those last few years of life, meaning in terms of health care. Why is that?
We do, and one thing we know is more care is not always better care. And I think this collaborative will foster physicians, hospitals, insurers to have a better awareness of that, to have that difficult conversation with the patient's family, so they can make an informed choice. And it's all about what they want.
Okay, let's do this. Can we shift over, if we could? By the way, and one more thing, the candidates, they are from hospitals. They are physician leaders. They are, who else? Who else am I missing?
Insurers, and also it's not just hospitals, it's post-acute care providers as well.
And potentially actually change the delivery of health care, Larry? You really believe that?
Absolutely. Our first lead-off session, which occurred just a couple of weeks ago, we brought in families and patients who had gone through really great end-of-life experiences with family members and really poor ones. And so we're patient-centered, and we're trying to bring the patient's choice into this and make sure patients' choices are honored from every single aspect that we can.
Okay, so we are taping in early March 2017. President Trump, speech to Congress, lots of talk about what may or may not happen with the Affordable Care Act, otherwise known as Obamacare. What is at stake? Put this in context for everyone, Betsy. What is at stake for the citizens of New Jersey in terms of what Congress and the President, President Trump, may or may not do as it relates to the Affordable Care Act, otherwise known as the ACA?
Here's what's at stake. Under the ACA, we've reduced our number of uninsured from 1.3 million to roughly 500,000. So we have 800,000 people who have been insured through Medicaid expansion or through the marketplace, and they are in danger of losing their insurance coverage.
1 second, Betsy. I was watching the president speak, and he said, quote, Obamacare is unraveling. It's falling apart. How could it be falling apart if more people are covered than ever before?
Well, I think in part he's not focused on the Medicaid expansion. He's focused on the marketplace where individuals have to go online and purchase insurance coverage, may or may not get a subsidy. My understanding is Congress has removed a large part of that subsidy, so that's part of why it's unraveling.
So, like, how do you, listen, we don't know what's going to happen, and we're not going to try to get ahead of this. We're not a news program, we're an analysis program. So things may happen, but they're happening slowly. When the president said, we didn't realize how complicated health care really is, you're smiling, did everyone else realize how complicated it was?
I think it's the most complicated issue of our time. And I think that what Betsy had just mentioned about the individual market is where the biggest problem will be. We have states in this country where there's only one choice on an exchange. In New Jersey, we have two choices on the exchange. And I think we need to figure out how to get the millions of people who are not purchasing insurance now. People have said no thank you to purchasing a plan, even though it's mandatory. To get them engaged in the system is the biggest challenge that the Congress will face.
So when those in Congress and the president and others say, we're going to repeal Obamacare, we promise we're going to do it, and people cheer, what's the problem with that?
Well, they're not yet talking about what the replacement plan is. The president has also said, I'm going to repeal and replace it almost simultaneously.
What does the replacement have to have, in your opinion, to protect those who are most vulnerable in this state?
What we are looking at is coverage. Well, 800,000 New Jerseyans, 22 million Americans have coverage. There's a difference between coverage and access, and I worry about that.
But what about, respectfully, what about those business owners who are saying they're having a very hard time, and individual citizens who are having a very hard time affording the care? I mean, doesn't that weigh into it as well on the economic side?
It absolutely does. But the people who have coverage need to maintain it. Our physicians have looked at this, and we've supported universal coverage for people for a long time. Single payer? Not single payer, but access to insurance, access to an insurance policy for everyone. Now, whether that's through a marketplace or whether it's through high-risk pools, having access to good quality insurance is important. People live longer, they do better health-wise if they have access to insurance.
Before I let you out of here, the New Jersey Healthcare Executive Leadership Academy, if somebody wanted to find out, watching us on public television, on Fios, and every other platform, digital and otherwise, if they wanted to check out, watching State of Affairs right now, who these people are and what the program is all about, how can they do it?
They can go to www.msnj.org/HELA, Healthcare Executive Leadership Academy. And there they'll see who the participants are. They'll see our funders. We're funded graciously by the Physicians Foundation and the Fannie Ripple Foundation here in New Jersey. And they can see the full roster and the topics that we're working on.
It's always important to fully disclose who provides the dollars. Larry and Betsy, thank you so much for joining us. We appreciate you unraveling all that.
Thanks, Steve.
Still more to go.
Thanks for having us.
Stay tuned. We'll be right back on State of Affairs right after this.
State of Affairs with Steve Adubato is a production of the CAUCUS Educational Corporation, celebrating over 25 years of broadcast excellence. State of Affairs with Steve Adubato is brought to you from the Agnes Veris NJTV studio at 2 Gateway. Funding has been provided by Jersey Central Power and Light, Passaic County Community College, Holy Name Medical Center in Teaneck, New Jersey, the New Jersey Association of Health Underwriters, New Jersey Sharing Network, New Jersey Council of County Colleges, and by Johnson & Johnson.